pile of drugs you see with a bottle of Jameson in the middle was given to me by a patient who I requested to bring in all the medicines that he's possessed from the years of treatment by other physicians. This pile of drugs that you see has been given to him by one physician. It's an extraordinary example of how prescription drug abuse in this patient can be a lethal formula, given the fact that alcohol and the pile of medicines here in front of you, Xanax, Valium, amphetamines of multiple classes, are drugs that unfortunately get into the hands of addicted patients by the local MD prescription. This is a critical topic that is something that physicians aren't educated about. Very little research is being done about this. Physicians aren't monitoring themselves, and in my opinion is something that needs to be addressed on a wholesale basis without a punitive approach towards physicians, but much more of an educating response that has some bite to it. Multiple states have enacted triplicate prescriptions, which have drastically reduced the prescription of addictive drugs because physicians are worried about the fact that they're going to be labeled as drug-pushing physicians. These are good initiatives that have been instituted by several states in the U.S. and have had major effects. The punitive nature that physicians are subject to by state authorities doesn't stop the fact that physicians are going to prescribe these drugs. There needs to be a physician peer review process with some bite to it over time for repeat offenders. Physicians are very much unwilling to be scrutinized by their own peers and made to feel that they're not being good doctors. This is a powerful tool that isn't being used. Agencies should be set up that create the potential for physicians to be monitored and other physicians and hospitals to report patients who've been iatrogenically addicted to drugs from prescription medication. When this occurs, physicians who've been doing this with their patients should be contacted, and re-education processes about prescribing addictive drugs should be instituted. If there's a repeat offense, those physicians should be subject to stronger and more aggressive interventions.